I know we've made some tough decisions in recent days, but there are lives in danger, and fighting the virus must remain our top priority.
Yesterday's modeling data was a wake-up call. We could have 1,000 cases a day by mid-month. So again, I have to keep saying, please don't let your guard down.
Cases of COVID-19 continue to rise in several parts of the country, and so too do the political challenges. How are governments managing this second wave of the pandemic, and at what cost? It's Thursday, and I'm here with At Issue, Chantal Hébert, Andrew Coyne, and Althea Raj. Good to see everybody. It's Quebec and Ontario obviously experiencing the biggest surge in cases, but BC is also struggling a bit. Alberta has seen a rise, and it's interesting to watch the different kinds of responses versus the first time round, where we were all sort of, just trying to figure out how to deal with it. Andrew, how much more difficult do you think it is politically trying to deal with this the second time? Are there things that they should know better or do differently? Or is the pressure sort of too much now this second time around?
Well, I think it's both easier and harder. It's easier in the sense that we know a little bit more than we did in March, when we were basically completely in the dark about causes, sources, et cetera. We have a bit more data now, a bit more, I think, potential for a more surgical approach than a pure across-the-board shutdown. But it's harder in the sense that people are less frightened, frankly. In the spring, there was a real ability to mobilize the public for collective action on this because the numbers were so horrifying. The numbers seemed, until recently, to be less troublesome. But, of course, the nature of this kind of thing is the exponential growth can come at you like a freight train. So I think it's a little more difficult to get the public to really pay attention and really focus in on the dangers involved here and to gather that kind of consensus.
And there's also, what everyone calls sort of COVID fatigue, whether that be from the public health perspective or from sort of not being allowed to do anything and the economy being restricted. Chantal, what does that, how much more challenging does that make it politically?
I think the real challenge is that you've gone from shutting everything down to a balancing act. And that is where the struggle really is, both in Quebec and Ontario. It's clear, and that would be the case no matter who would be premier, that premiers want to keep schools open. But cases are rising. It was a lot easier to just shut everything down. Yeah. They are desperately trying to avoid that. And kind of making it up as they go along. And every time that they impose new restrictions, I've seen in Quebec this week, people are trying to find the tread line. It was easy to see the tread line when you were shutting everything down, but why are you shutting down theaters and not hair salons? Yeah. Was the question this week. So it's a lot tougher, and it requires a lot more tweaking from day to day to day without knowing if it's going to work.
Yeah, and the messaging is confusing too. Elamine and I talked about it on the podcast this week. You say to people, don't go out and make sure you're not socializing, but you're keeping bars and restaurants open in Ontario anyway. So it kind of makes it difficult, I think, in some ways, Althea, for governments to be coherent or for people to hear a coherent message.
Inconsistent messaging. I would agree with everything and echo what Andrew and Chantal said. But the other thing is that the public is now armed with a lot more information than they themselves had. Forget about the provinces. So we are doubting the information that our politicians are telling us and the medical officers of health, and we are questioning the guidance that they are giving us because it is inconsistent compared to the spring. Stay home, only go out if you absolutely need to, pick one person to do your groceries. Now you're saying send your children to a classroom with 30 other kids, several of your children if you have several children in school, exposing yourself to multiple people. If you're in Quebec, the premier is saying, well, but then you can't have anybody from another address come visit you at the same time in your house unless you live alone. In Ontario, they're saying you can still do in-room dining, but the classrooms are still going to be 30 plus kids, not 15 as we originally told you in the spring, which was the guidance from the healthcare experts. So there is less willingness, I think, for people to participate in this communal project, if you wish. The other thing I think is that we are starting to blame governments for decisions that the public think don't make any sense. That we think that they should have been prepared. They had 6 months to prepare for back to school. They don't seem to have done a great job about it. In Ontario, for example, we had 80,000 backlogs of cases. So, then there's an expectation for people. Well, you told us back in June to go get tested if we had no symptoms. Now you're saying if you have a runny nose, stay home. But you're also telling us that your kid, probably 17% of them, the kids that had COVID, had runny noses. None of this makes any sense. So I think that is really where the trouble lies.
And the federal government, too, is trying to respond to all of this in different ways, because it's obviously different across the country, as we've talked about today, announcing a $10 billion infrastructure spending announcement. And I want to play a little bit of what the Prime Minister had to say about why that's happening now.
We are, of course, primarily concerned with the situation facing so many communities around the country with the second wave of COVID-19. At the same time, though, as people are struggling through this pandemic, people are also thinking about what's next. What lessons have we learned from this pandemic? How we're going to build back better?
I mean, Chantal mentioned a balancing act. I mean, that's a balancing act, too, trying to see the opportunity as we're still facing the challenges, Andrew.
Opportunity, political and otherwise. I mean, I still think this is vulnerable to the critique that he should be focusing on the specific task of fighting the pandemic. If there's a more core role for the state than public health, I don't know what it is. And yet, we've just been talking about the many ways in which governments have not been addressing that, have been dropping the ball on that core responsibility. And at this very moment, it seems rather odd to be saying, let's expand that into all kinds of other sectors and other kinds of other areas that have not previously been either federal or government responsibility, and to be doing so with a lot of borrowed money. So, yeah, there's an opportunity there, I suppose, because people are, we've been so thrown off of our previous benchmarks as to what fiscal responsibility amounted to. But I think there's also dangers there.
Yeah, I mean, that announcement today also promised to create 60,000 jobs, which is part of their $1 million job promise. And I guess part of that, Chantal, is about sort of lining things up when or if things ever get back to normal, too.
Well, two things. For one, I think at this point it's harder to be a premier in Ontario, Quebec, or BC and Alberta than it is to be the Prime Minister. And that goes back to the fact that provinces are sovereign when it comes to healthcare. And when it comes to education. So they will be in the line of fire. When Paul Martin cut the rate of increase of the health transfer, he got rewarded for keeping public finances in good order federally, and the provinces paid a high price for the healthcare system cuts. So up to a point, Justin Trudeau is not in a bad place. The other thing is, I suspect the initial reaction to the throne speech is probably made the federal Liberals feel freer about doing what they wanted to do. And that is that the reception, when you look at, two polls this week, it either strengthened or improved the Liberal standing in the polls. So it seems that throne speech, despite the fact that it was panned by so many experts, did hit the mark. And then it's hard to argue that the federal government is doing nothing that is worth talking about when you have an unanimous vote in the House of Commons for the latest relief package.
Yeah, which was interesting because it was far more targeted than the initial aid package. That is something, I guess, a lesson that government has already learned. Althea, your thoughts on how that balancing act that the Prime Minister sort of articulated today?
Well, the infrastructure announcement is actually not really new. This $10 billion is part of their $180 billion infrastructure plan. It's all directed at things that they've outlined previously, green buses, climate adaptation, broadband internet. These are things that we've talked about during the pandemic, but these are things that Liberals had already committed to. And in some ways, in the spring, we criticized them for shutting down Parliament and basically being only focused on the COVID response. Everything else was on the back burner. They weren't moving on anything. So I'm not ready to criticize them at this point and say, well, hey, you're trying to show that you can walk and chew gum at the same time. I mean, I reserve judgment because the infrastructure bank has not been a resounding success. It has actually really not done much. So if it can prove to get these projects going, let's see, and then we will judge. I think that part of what's happening in the Prime Minister's office and in the government writ large is that people are getting so used to this astronomical amounts of money, 10 billion here, 10 billion there, that they're just like, oh, we're just going to keep piling and nobody will notice whether we're $340 billion in deficit or $396 billion in deficit. I think that is kind of what is happening. And we're going to see more and more legislation and actions that have basically been on hold since the spring come forward in this next session. Like just before the throne speech, I was told there were cabinet ministers had 40 pieces of legislation that they wanted introduced this fall.
All right, let's move on to another part of the story, and that has been the push from the Conservatives around rapid testing, the testing backlog. Here's a little bit of what that sounded like in question period.
Everyone is working crazy amounts of hours to try and get all the tests we get in a day done, and it's just not possible. Mr. Speaker, will the Prime Minister admit his failure to approve rapid diagnostic testing is leading to the burnout in our frontline healthcare workers?
On this side of the House, we believe in science and evidence. I get the impression, Mr. Speaker, that the member across the way, if he were in this position on this side of the House, would put the iron fist down to the Health Canada scientists, to the people that are working hard on evidence-based decisions, and make a political decision.
Okay, this is not a new argument that we've heard from the Conservatives. It's been happening over the course of a number of weeks. And, you know, I understand the frustration that people have around the testing for sure. And I guess that's what they're trying to tap into. But I also wonder if there's a risk to that. I'll start with you, Andrew, because, you know, you would assume that Health Canada is doing this independently and should be approving tests independently. But the Conservatives are couching it in the way that somehow the government should be doing more or is in some way responsible. So how do you read that?
Well, and lo and behold, just before they went into question period, the government did announce progress on this file. Look, there's a lot of things you can criticize the government for in its response to the pandemic going back to January of this year, or sooner. Yeah. Setting aside the Global Public Intelligence Network, our eyes and ears abroad, and therefore making us more reliant on China and the WTO. It proved to be, I think, a terrible decision. Not picking up the pandemic strategic plan that was on their desk when they came into office. The failure to close the borders sooner, the failure to stockpile PPE. There's been a lot of things. This specific one smacks a bit more of, oh, this tests well with the focus groups at this particular moment, and so let's jump on that. I think there's a more broad-ranging critique to be launched and to be made about the government's response, but I think they were tempted by the passions of the moment.
Yeah, especially too because, Chantal, I mean, the federal government obviously has a role to play in testing, but it is the provinces that are administering things, that are deciding where the test centers are going to go and how many tests they can process in a day.
And who needs to get tested.
That's right.
And that's been a movable feast, as parents in Ottawa can tell, and you're one of them. Runny nose last week needs a COVID test, not as of today. Yeah. So the frustration, in large part, has been driven by provincial and local decisions. I agree with Andrew that I think the Conservatives saw a low-hanging fruit. And it's a legitimate low-hanging fruit, except that the rug was kind of pulled from under Erin O'Toole on it by approving a fast test. I'm not totally convinced that approving that test will necessarily resolve the issue. There are provinces that are doing better with testing than others. So it is also a matter of the organization in place by provinces.
What did you make of that tack that the Conservatives took this week and have taken for a few days now, Althea?
Well, I think testing makes sense for all the reasons that you've outlined. People are frustrated and they would like to blame someone. But nobody personally really believes that Justin Trudeau is personally deciding whether or not to approve these tests, right? I think that the general public believes that Health Canada is responsible for approving these, and maybe they're taking their time, and maybe we should be following some of the other countries in CETA, for example, who have approved tests that are not yet approved in Canada. That was something that Erin O'Toole was suggesting just this week. But the flip side of the argument, I think, is also possible. Like, you could also imagine Erin O'Toole saying, why is the government not waiting for Health Canada to approve these tests and going and with what the other countries are saying. Like we should be, safeguarding our own national supply and making sure that our sovereignty is respected. So I think in some ways this just took things away from other potential criticisms that also make the Tories kind of binds their hands in some ways. Like we saw this week, for example, that the Tories voted unanimously with the other parties to approve C4, the government's legislation extending government benefits, creating sick leave. So how on the one hand can you say the government is spending too much money, dragging us into debt, because you also don't want to be accused of withholding benefits for people. So testing is a safer issue to explore than trying to, square that circle.
Well, that's a good point, because, and maybe I'll just wrap by getting everyone to sort of evaluate Erin O'Toole's first week-ish in the House. He was only there for a couple of days when he came out of self-isolation. But, the complaint from the Conservatives around C4 was because the government was invoking closure and shutting down debate, but then they voted in favor of the measures because, as Althea says, be hard to explain to Canadians why you were preventing those benefits. I don't know if you have a first sort of take, Andrew, on how Erin O'Toole's Conservatives are faring at this point.
Well, I don't think that was necessarily inconsistent. They'd made their point about the procedural question, but then they're not going to hold provision of critical aid. I think, I've had some complaints about some of the policy stances he's made, but they're probably good ones from a political standpoint. I think he is striking a tone of professionalism and of normalcy after a period in which conservatives and conservative leaders have not always been featuring either of those qualities. So I think he's actually off to a relatively good start in that respect, of that people can look at him and say, I understand what this guy's about. He seems like a regular guy. He also seems to be, relatively well briefed and on top of his files. I thought he gave a good first speech in Parliament. So all in all, I think it's promising.
Chantal?
I agree. I thought he kind of reset the Conservatives in the House of Commons in a constructive way this week. They are on topic, and voting for C4 does not detract from the point that they were making about Parliament not having had enough time to maybe look at some of the imperfections, glaring ones possibly, that will result from adopting legislation really quickly. When was the last time, I've tried, and I have a good memory, when was the last time that the leader of the Conservative Party in opposition has asked the first question in question period about Indigenous reconciliation?
Yeah, I have a good memory too, and I can't remember that.
No, and I thought that sent a really strong signal that this is under a new management. I also listened to that first speech in the House of Commons. I think that what Mr. O'Toole doesn't have in charisma, he makes up in depth.
Althea.
Yeah, I was going to just add to Chantal's point. Like, it was very also strategically smart. The Conservatives under O'Toole have made a key priority of building in Quebec. And on Wednesday, the story, unfortunately, was that poor woman who died in the Joliette Hospital with the staff saying really horrendously racist things to her. And that question on Indigenous issues ensured that Mr. O'Toole was going to be talked about in the context of that story. So that was really smart. His speech was also, there was depth in there, but there was also, it was accessible to a whole range of Canadians, no matter where you are on the political spectrum. Really a wise and struck a very statement-like tone. I will say, though, that I do think he is quite a partisan person, and sometimes his questions in question period go just a little too far. Like, I don't know that everybody would say the Liberals have done nothing on reconciliation. Have they met their targets? Absolutely not. But if you just lower that hyperbole a little bit, then, you would be accurate, and people, even Liberals would be able to agree with you.
He also has to be careful.
Okay, last word to you, Andrew.
He also has to be careful not to overreach. It's fine to have a big tent, but if you push it too far, the tent collapses. And so some of the rhetoric around his Labor Day video, for example, I think would be confusing to Conservative supporters. Going too far in pitching your tent for Quebec nationalist voters, I think, and you risk losing votes in the rest of the country. So he's got to be careful he doesn't go too far.
Okay. I'll leave it there. And just so everybody knows, yes, that was a dog. And yes, it was at Andrew's house. Wanted in on the conversation. Thank you all very much. Chantal Hébert, Andrew Coyne, and Althea Raj. See you next week.